A healthcare executive that I know, that we'll call James, was feeling bad and needed to decide between two different facility tiers, but he couldn't figure out which one would cost more before deciding where to go. So he left without being seen by either. That same scenario has played out across 47% of American adults last year, according to Tebra. They avoided care after getting a bill that was higher than expected. And it's not necessarily because they couldn't afford it. It's because the system gave them no way to know in advance. I've spent years watching people make healthcare decisions with incomplete information, not always because they didn't know where to look, but sometimes the information just isn't there to find. James is a health tech executive, and he knows how to research a purchase. But he stood in that facility parking lot and still couldn't answer a basic question. What is this going to cost me? So this video is about why that question is so hard to answer, what it means for the companies that are building the systems that people are supposed to use to find out. Let's go. James needed care that evening and he had a choice to make. But he couldn't get a straight answer on what either option would cost before he was committed to finding out what was wrong. So he left. A healthcare executive is someone who navigates complex decisions professionally. And just like all the rest of us, he's unable to price a medical visit. 60% of Americans expect to delay or skip care in 2026 alone, just because of cost, according to Tebra's April 2026 survey of over 1,000 U.S. adults. The RevSpring National Survey from May 2026, which reached more than 2,000 adults, found that 79% have been surprised by the amount on their medical bills, and 50% have cut back on care because of cost confusion and coverage uncertainty. We're all left to make the most rational decision that's available when the information that we need doesn't exist before care happens. In 2021, CMS implemented the Hospital Price Transparency Rule that requires hospitals to publish their prices. As of 2024, roughly 91% of hospitals are technically compliant, according to research that was published in JAMA Network Open by Mayo Clinic researchers. The prices are posted, but the problem is that facility fees, which account for 80% of ER visits, remain functionally unpredictable to the person who's trying to decide in real time, should I go or should I stay? Compliance with the rule and legibility to the patient are two different things, and of course the CMS rule only required one of them. The EBRI data published in Medical Economics in March 2026 shows that cost is now the most commonly cited reason that people delay or avoid care altogether. Deductibles are nearly universal across plan types, so this stopped being a high deductible plan problem a long time ago. Every 3 years, the Commonwealth Fund publishes a report called Mirror Mirror that ranks the health systems of wealthy nations on access to care, care process, administrative efficiency, equity, and health outcomes. The 2024 edition ranked 10 companies like this. 1. Australia. 2. Netherlands. 3. United Kingdom. 4. Germany. 5. New Zealand. 6. Sweden. 7. France. 8. Canada. 9. Switzerland. And coming in dead last, the United States of America. Out of 10 wealthy nations, countries with single-payer systems, multi-payer systems, mixed systems, the U.S. is last. And is anyone surprised by this? The administrative efficiency domain, which measures how much burden patients and providers carry navigating billing, insurance rules, and cost-sharing requirements, the U.S. ranks 9th. Little tiny improvement. And the only country below us? Switzerland. All the other countries on the list found a way to make the cost of care knowable before the patient commits to finding out what's wrong. The U.S. has not, and that is a policy choice. I've definitely had my share of situations like James before, too. One Saturday, when I was still dating my late husband, George, he wasn't feeling well, so I took him to urgent care. But they turned him away because he had a specific ACA, Obamacare plan, from Blue Cross Blue Shield that the urgent care would not accept. The right insurance company, but the wrong plan type. I had United Healthcare at the time with my then employer, a well-known tech company. So when we walked back to the parking lot together, I pulled him to the side and looked him straight in the face, this close. And what I said to him was, "You will never be turned away for care ever again." A month later, we got married, and then about a month after that, he was able to start dialysis. George ran into something sharp, price opacity, which is the opposite of price transparency. He never got the price. He was refused at the door over a technicality that had nothing to do with whether or not he actually needed care. James couldn't find out what care would cost before committing to it. George couldn't get in at all. And these aren't edge cases, unfortunately. It's what happens when you're navigating a healthcare system that requires information that either doesn't exist or isn't visible until after a decision has been made. The question that people are always thinking in their heads when it comes to a hospital visit or a doctor's visit is this: what is this going to cost me? As someone who travels internationally quite frequently each year, I run into this all the time with American travelers in other countries. I've seen where people have fallen and gotten hurt or other mishaps overseas, and they were treated at places that were way cheaper. Way, way, way cheaper. I'm not even talking about medical tourism. I'm just talking about an incident happening abroad. But yet, it's just not that simple here. In a related issue, I talk about why it is so hard to pay a medical bill for someone else when you actually have the funds and access to that person's account. You can watch that here. You got to do the proxy access dance, reset your password a bunch of times, try calling every number on the statement, and then getting stuck in the loop of, are you the patient or are you calling on behalf of the patient? But what happened with my sister was different because she wasn't trying to make a clinical decision or even look at our mother's medical records. All she was trying to do was pay the bills from the hospital, all the last bills that she had right after she took her last breath. All she wanted to do was